Again, welcome. Thank you everyone for joining. Welcome to Advocacy 101, hosted by the American Muslim Health Professionals. My name is Samroz Jakvani. I am the Health Policy and Advocacy Manager for American Muslim Health Professionals. Um, we'll go through some of the learning objectives first, then we'll go through the agenda real quick. Um, so the learning objectives essentially are for you to be able to converse with legislators, decision makers, and other policymakers, whether they're at the local, state, or federal level. They may also be agency leadership or other staff members at other organizations. So uh, the learning objectives there is to ensure that you are aware of how to do that, that you walk away with the confidence to be able to do so, and that you have a little bit of competency on certain healthcare issues or public health issues that are emerging or trending right now. I'll just go through the agenda very quickly. Um, And if you all don't mind, we'll actually just take a brief moment to do an icebreaker activity. If you don't mind just sharing your name in the chat, as well as your interest in health policy and advocacy, would greatly appreciate that. We'd love to know a little bit more about yourselves as well. It also gives us just another minute or so to allow folks to join. We're about 28 participants right now, and we're expecting close to 100. So just bear with us. We still got some folks trickling in, so I would appreciate just to know a little bit about yourself. Thank you. In the meanwhile, I'll go ahead and continue with the agenda. So again, we'll have this introduction. I'll tell you a little bit about American Muslim Health Professionals. We'll cover some basics of advocacy. We'll go through the policymaking process very briefly. We'll talk about some advocacy skills development and how to create a compelling pitch, as well as an elevator pitch. We'll talk about the specifics of engaging with policymakers or their staff. We'll talk a little bit about community engagement and coalition building. And we'll discuss some of AM's policy priorities as well as some other public health priorities. We'll finish up with some tools and resources as well as some next steps, and then close up with some Q&A. Tell you a little bit about AMP. American Muslim Health Professionals is a national nonprofit organization focused on fostering collaboration between Muslim health professionals from diverse sectors of healthcare and public health. We seek to advance public health, social justice, and civic engagement within their communities. We're about amplifying the impact of diverse health professionals, not necessarily those who are Muslims, but those who are, from every background from across the United States, who serve different populations in different ways. And certainly we seek to improve health for all Americans, and especially disadvantaged populations, including those diverse ethnic or racial backgrounds, religious backgrounds, including those of the Muslim faith or other faiths. AM's mission is to bring together and strengthen the impact of Muslim health professionals to improve the health and wellness of all Americans, as I alluded to. We have three main areas: health policy and advocacy, mental health, and professional development. That is something that is sort of dynamic in the sense that we had our strategic planning retreat recently, and so we're looking forward to improving the breadth of our work and aligning to the needs of our populations and our communities. So we'll get right into it. What is advocacy? So I'll cover some basics of policy advocacy and lobbying. Policy is a very broad term that encompasses advocacy, lobbying. It includes committee work, it includes rulemaking. So whether you're on a committee working with a federal agency on requirements for a WIC office, for the WIC program, or you're working with the Liquor and Cannabis Bureau on regulations that would allow peace enforcement officers to detain youth. It can look like a number of things. People generally tend to think of it as exclusively related to legislation and bills, but we are here to very much convey the idea that advocacy comes in many forms. And in many media, you are able to convey the burden of a given topic. And we'll talk a little bit more about that. Advocacy is essentially advocating for a given topic, an issue for a population or a community. What it is not is lobbying for a specific cause or, for a specific piece of legislation. So this is something that many agencies have to be very careful of. It is something that as community members, you may have to be less mindful of this, but certainly as whether you work in government or you work in an agency, it is very important to keep the difference in mind between advocacy and lobbying. And what it comes down to is lobbying will include a specific ask. So advocacy will be, this is the impact of HR 555 on Americans, on American Muslims. This is the impact of the maternal child health crisis. This is the impact of tobacco use and vaping. This is the impact of XYZ on XYZ community or on the American public. Or, you can even talk about how perhaps the impact of private equity on healthcare, right? Can be educating on the costs. It's educating and informing. That is something that, as myself, as I've had the privilege to serve in several government agencies, that was sort of how we walk the line. As long as we're educating and informing, we are okay. We do not include a specific ask on a given bill unless you are approved for lobbying. And so again, just to recap, advocacy would not include an ask on a given piece of legislation. Lobbying would include, please vote yes or please vote no on a given piece of legislation. And if folks have more questions about this, we can dive more into it. But I would encourage you all to not let this inhibit you from conveying the burden of a given health topic, from conveying data, from conveying stories that would advance your priorities and the priorities of the public health sector. So why is it important for you to advocate? Many of you are healthcare practitioners or maybe students, you may be pharmacists, they're physical therapists. Why is it important for you to advocate? Because your voice matters. I've listed some bullet point here. You can feel free to read them, but really your voice is unique because you have the privilege of being you have the credibility that comes with whether you're a healthcare provider or you have healthcare related information tangentially, you have a given credibility that comes along with that. As an individual, as a community member, you have a given credibility that comes along with that. As a constituent, if you're speaking to a legislator, you have credibility that comes along with that. So it's important for you to advocate because your voice matters. You come with your own identity, with your own set of experiences. And as it's listed here, less than 10% of the electorate ever contacts their legislator to support or oppose pending legislation. Again, that's more relevant to lobbying, but it conveys the point that very few folks speak to their legislators about the issues that matter to them. And we'll talk a little bit more about this, but it's always important to remember that legislators are people and they're moved by stories and personal moments and experiences. Often more than they are by data. We'll leave it at that for the moment. Again, just to cover some basics, what is the bill? A bill to create a new law can be introduced in either chamber of the House or either chamber of Congress, House or the Senate by a lawmaker who sponsors it. Once it's introduced, it's assigned to a committee. The committee members will research, debate, make changes to the bill. The bill is then put before the chamber to be voted on. Appropriations can also be bills, but they're budget requests. Sometimes there's confusion there. Get into a little bit more about this. You've all likely seen the video, I'm Just a Bill. I'm not going to play that for you, but feel free to look it up on YouTube at your own risk and pleasure. Many of us have seen that in elementary school, but it goes through the policy process a little bit. The policy process is generally the same. Obviously, when you're talking about local levels of government, perhaps, a city, the city level, village level, county level, there are likely not two houses there. So, you may have a board of health, you may have a committee that you're working with. And so those committees, those boards pass laws in the same way where it may go through a given committee. So for example, at the county level, an ordinance to address aerial spraying of manure, for example, may go through health committee as well as land and water use. It may go through transportation and several others, just as it would perhaps at the federal level. It's also important to think about how authority flows from the federal level to the state level down to the local level. It's also interesting to note how policy is it kind of takes over in waves where, for example, take Tobacco 21 as an example. It started at a local level, at the city level, grew to the state, and is now federal law. So that's often the case. And so, as many things in policy, it's a bidirectional landscape. Key stakeholders in the policymaking process are, of course, your legislators, your agencies, but your most important stakeholders are your community stakeholders. Oftentimes, depending on the issue that we're talking about, or how much spotlight there may be given to an issue, industry stakeholders can be very, very impactful. And as we were talking about earlier, oftentimes people don't make it. Your typical community member doesn't often make it to committee sessions to offer testimony and provide support. And we'll talk a little bit more about how to make that easier for you all and how to, make that easier for the community. But industry stakeholders are often a force to contend with. Hopefully you all continue to, increase your exposure to the policymaking realm, whether it's health related or other social determinants of health related. And I hope that you this training is a key part of that. So what skills are helpful when you're conducting advocacy? Perspective, it's good to understand your perspective, be informed about the perspective that you're coming from. If you're representing an agency, if you're representing a group, ensure that you're well informed. It's of course very important to have personal stories to make that connection more meaningful, to make the case more meaningful. It's very important to have meaningful data as well. Data can be skewed a number of ways, and it can, there's no end to the data that you can pull from a given dashboard or a report. And I'll give you a couple of examples of meaningful data in just a moment. But really important to spend some time researching and crafting your message. Make sure that it is aligned with your objective. Be strategic with the stories that you bring, with the data that you bring. Make sure it is aligned with the perspective that you are conveying, and ensure that it aligns with your ask. Numbers are very important. Or this does not allude to the data. This means to show up in numbers. If you, are one person, that's great. But if you're 5 people, that's better. And if you have a group that you can represent, that goes even further along. Effective communication, ensure that you are able to make the small talk, ensure that you're able to convey the depth and the breadth of the issue that you are educating and informing on. Ensure that you can dial up the language and the emotion when you need to. And then lastly, this is a tool. Repetition. And again, I'll say it, repetition. You will have to make the case far more than many times. I don't know of any law that was passed with a single email or a single communication. And so I cannot make it clear enough that repetition is one of your most important tools. Don't hesitate to send multiple emails to staff. They are aware that they are not responding to you in a timely fashion most of the time. And they won't mind if you send them some reminders. Oftentimes they will appreciate reminders, and they will let you know that as well. Now, if they're asking you to hold off, then take that in as well. Some additional advocacy considerations. Know your audience, know the legislators, do your research on them to the extent that you can. Know their staff. Their staff are incredibly important. Oftentimes you may not meet with the legislator, you may be meeting with their staff. You will absolutely be coordinating with their staff. Otherwise, whether it's for scheduling or exchanging other information. I'll give you an example. We, meet with a number of staff. Oftentimes their staff will reach out and say, hey, can you look at the most updated version of this bill? And we'll talk about congress.gov in a moment. And we generally direct folks to look at congress.gov for the most up-to-date versions of things. But oftentimes it comes from their staff, and cultivating those relationships with their staff is incredibly important. And if you can find out a little bit more about their staff to help you in those conversations, it is very important to do that. Of course, know your community, know who you're representing, know their stories and their perspective accurately and completely to the extent that you can. Know your goals, know what your ask is. Um, you know, obviously, if we're not talking about lobbying here, but make sure that when you're educating on a given topic, that you are coming in with, this is the topic that we're educating on, this is the burden of the issue, and these are things that can be done. Whether policy proposals, more generally, you can educate and inform on specific policy proposals as well. So ensure that you are clear on what your ask is and be strategic with that ask. Important to know the context of the issue. So don't, if a bill is well on its way to being passed and, passed this morning, be cognizant of that in the evening. It's an obvious example, but you understand there. Know if you're a member of Congress, we generally refer to them as MOCs. Know if your MOC is a champion, a supporter, an undecided, skeptic, or opponent. Those are pretty commonly used categories that we use for MOCs. So know where your MOC is on that, whether they're at the federal level or if they're a legislator at a state or local level. Know where they are on that. Do your research. And we'll talk a little bit more about that as well. GPS. Grab attention, paint a picture, and use strong language. Be true to your story and of those you represent. I touched on that. Be consistent with your message. Make sure as you are educating on policy proposals or a given issue, make sure that you're consistent. If you're educating regarding a specific community, maybe stick to that community. If you're educating on multiple communities, ensure that you're contextualizing that from the start. A little bit more specifics about meeting with your legislator. So before your meeting, you're going to send an email likely to their office or to a staff person to set up the meeting. You will likely include some background information on there. It can be quite simple, but send them an email with a preferred date, time. They may counter that with something else. They will likely not take you up on whatever you offer, but do offer a specific date, time, and method of meeting. Do your research, of course, know your representative. As I mentioned, know their staff if possible. Definitely know the topic that you're educating on. And if there are resources that you can provide to them early on, do that. So I'll show you all in a moment, but AMP has developed fact sheets, and we'll be continuing to develop fact sheets over the coming months on various health issues and health topics. But if you have resources like that, send it early on in your initial email. If you have something that talks about the organization overall, send that as well. If you have something that conveys the strength of a community organization, if that's who you're representing, or a larger group, include that information as well. At the time of the meeting, of course, introduce yourself, and that's where you'll have the opportunity to start some dialogue, right? And so, you'll of course provide your name, an agency or community organization if you represent that. But there's an opportunity there to start some dialogue with the staff, and I will take this from my colleagues' previous training. She was keen to mention that in short, it's important to maintain flexibility. It may be that you are promised a meeting with the legislator and you end up meeting with their staff. As I mentioned before, the staff are incredibly important. And so equally important to meet with them, provide them the same information. Make sure you don't look dismayed or disappointed if you're meeting with the staff member. But as I was saying, ensure that you start up that dialogue with them, make the small talk. If there's some, common ground that you can find and sort of leverage there, definitely do that, whether it's about, where you're an alumni or the weather, whatever helps you kind of find that common ground. Brief on the issue. As I mentioned earlier, lobbying would include a specific ask, but brief the legislator or their staff on the issue. Develop your elevator pitch, and we'll talk about that in just a moment. Include that specific ask. And then there's an opportunity after that to explore what that legislator cares about. And this is something that's important to remember, that when you're meeting with legislators and you're conducting advocacy, this is a two-way street. If you want that legislator to vote consistent with your values, with your strategy, with your objective. They may be looking for something from you as well. And that can look like different things. It may be input on something. It may look like something very different. So explore what they care about. You know, it may be that they're looking for a connection to the community somewhere. It may be that they're looking for an informed perspective about something. So after you're done briefing them on the issue, you know, you can explore it tangentially from the issue that you're talking about. You can also just ask them, you know, hey, what else are you working on? Or what else is kind of taking up your time these days? And they'll usually be happy to talk about that. And if there's an opportunity there for you to find something that cultivates that bidirectional relationship, do take advantage of that, because it will pay dividends. Conclude your meeting appropriately. Don't overstay your welcome. Remember that these meetings do not last long. It is rare that you will ever get near 30 minutes with the legislator. It's often like 15 minutes. You know, even with their staff members, it's not longer than 15 to 20 minutes, regardless of what's on the books. After the meeting, ensure you follow up with the summary and resources. You know, if you have an opportunity there to touch on the small talk that you made earlier, do that as well. But ensure that within 1 or 2 days of that meeting with the legislator or their staff, that you're following up with the summary of the meeting, resources, if you talked about those, resources if just you felt like they were appropriate to include, and then continue to cultivate that relationship over time. Find something to touch base about, you know. We'll talk about the elevator pitch next, and it's pretty simple. You've got to figure out and convey who are you, what is the important issue, why is it important, and what should the audience do, all within 1 minute. And so spend some time on this. There's a lot of tools out there. There's templates. There's AI tools to help you with this. There's, you know, a lot that you can do to create a beautiful, concise pitch. You know, some folks will bring in props or visuals, and that's helpful. But I think for myself, what I found helpful that works with my communication style is to bring in, you know, printed resources early on, provide that, and just speak more simply, without props or without, you know, visuals to point to. Just speak sincerely, speak thoughtfully, and speak with clarity and brevity, and that will that does me the best, at least, and it likely will for others as well, given that it's sort of best practice. Develop a 1 minute elevator pitch addressing these 4 issues, and you know, as long as you're doing that, it's a pretty foolproof rubric. This is a policy brief that we created with one of our wonderful partners, IFANCA, that's the Islamic Food and Nutritional Council of America. They do amazing work to promote healthy nutrition and halal food access. But this is an example of a resource that we might provide to a legislator when we're talking about food security, as an example. We touched on this earlier, but community engagement. Strength in numbers generally equals amplification of efforts. So engage your community as much as possible. You will almost always find friends, family members, folks in the community, you know, whether it's through a healthcare organization, a healthcare related organization, a public healthcare organization, an advocacy organization, a community organization. It could be like a faith-based organization. AMP, of course, has a wonderful network of healthcare professionals and allied healthcare professionals across the country. So there's an opportunity for you to leverage those groups as well. So reach out to folks often, ask them if they're willing to join you if you're, you know, meeting with legislators, or if you're, you know, even planning things, right? Grassroots advocacy is incredibly important for that reason. It is what has created change on all the different fronts that we see, from the Affordable Care Act to Tobacco 21 to other issues. Advocacy and grassroots advocacy is how these changes are enacted. Mobilizing communities, incredibly important to meet with your legislators, but it's also incredibly important to help to mobilize your communities on various healthcare issues. And you know, we always encourage folks to sort of cultivate their passions, and you know, if you're very passionate about a given topic, chase that and mobilize your community around that topic, and you will I'm sure that that enthusiasm will bleed through and you'll be able to mobilize other folks into joining your advocacy, and then, to increase that collective impact. Where possible, build coalitions. If there's other groups that are aligned, bring them into the fold, as it is with legislators, it can be bidirectional with your partners as well. It generally needs to be bidirectional. Finding that synergy and collaborating to increase that collective impact is incredibly important. That's how things get done in healthcare and public health and elsewhere. And when it comes to grassroots advocacy, community engagement, building those coalitions, building those partnerships is incredibly important because whether it's to legislators or to the public, it conveys strength. It conveys that the burden of the issue that you're educating on is worth paying attention to. And then just to reiterate, ensure that you're engaging with community, key stakeholders, and leveraging collective resources. Those collective resources alludes to whether it's, financial resources or otherwise. It may look like an event space. It may look like grant funding. It may look like free gear that an organization has. Leverage those collective resources and engage your populations, engage your stakeholders. Think critically about who your stakeholders are. It can look like private, public organizations. It can look like not-for-profits, but think, diversely about who your partners may be. And we'll talk a little bit more about this in just a moment. But as you consider the social determinants of health and the breadth of partners that relate to the social determinants of health, it opens up a lot of avenues through which you can, consider the Department of Transportation a partner, just as you would the library and the school district, and your local clinic. That's a perfect segue into AMP's policy priorities. Recently, after engaging with our board, the community members, other healthcare professionals, as well as our partner organizations, these are AMP's policy priorities. Recently developed, and we're still developing resources on these. We have developed a fact sheet on health and nutrition access to halal food, which is available on our website, and look forward to resources on all these issues. But health equity and social determinants of health, as I mentioned, health equity has become sort of a buzzword, but it also has enacted a lot of significant change around the country. I can give you, no end of examples. AMP has been very active on the health equity front and addressing social determinants of health. Particularly during the pandemic, AMP was instrumental in addressing health equity as it related to vaccine hesitancy, and ensuring that resources were appropriately allocated to disadvantaged communities where it was possible for us to conduct that advocacy. Social determinants of health, of course, alludes to these categories of factors that affect health that aren't traditionally health related, whether it's, public safety, income, things like income we know are very much directly tied to our health, as are all the other facets of the social determinants of health. So whether it's public safety, access to, employment, opportunity, those are all really important factors to include in your conversations with legislators, with community members. It's a holistic perspective that resonates very well with people these days. I think with all the different, guidances that we receive from our healthcare practitioners and other organizations, folks tend to want to kind of move to a more broad perspective, and we see that in healthcare delivery. We see that more broadly at the federal level as well, where social terms of health is a perspective that is getting funding, it's getting attention, it's getting research attention as well, and it really resonates with community members as well. Access to healthcare, of course, is a traditional avenue that AMP has been working on for many years now, from the Affordable Care Act onwards. And prior to that, we'll continue to work on access to healthcare, improving it for marginalized populations as well as the overall population. And then, within these, and I'm sure that's fairly obvious, there are so many different fronts that can be addressed, whether it's within health equity and social determinants of health, right? You talk about health equity, you can talk about the WIC program. You can talk about immunizations. You can talk about environmental health. The same goes for access to healthcare. You can talk about Medicare and Medicaid expansion. You can talk about access to mental health care services. Behavioral health, of course, includes mental health as well as a number of other things. Um, but there's a number of things within behavioral health that are, receiving a lot of spotlight. AMP is currently working to address some gaps in the research on behavioral health as it relates to the Muslim population and other populations, including refugee populations. So, looking forward to sharing more on that over the coming months. As it relates to maternal, child, and family health, as I'm sure many of you know, there's a maternal child crisis in this country where, if you look at certain populations, we are ranked far behind most of the developed world. If you're Black or brown, you stand at higher risk for whether it's infant mortality, maternal mortality, and a number of other adverse health outcomes. And so, AMP recently published an op-ed in APHA's online publication. So please do look at that. We were writing to inform and educate on the Maternal Health Omnibus Bill, an incredibly important omnibus bill. We fondly call it the Omnibus Bill, to address maternal, child, and family health. Um, Healthy nutrition, access to halal food. As I mentioned, Ifanka is a wonderful partner that does amazing work on nutrition, access to halal food, and across a number of other social determinants of health. They work with a number of schools to ensure that students have access to food, but they also have access to the resources and technologies to ensure that they're successful across the lifespan. Youth mental health, we listed behavioral health up there, but right now youth mental health is in such an adverse state that it's worth calling out on its own. Evidenced by whether it's the Surgeon General's report or the many emerging issues that we see related to illicit drug use, whether it's ketamine, psilocybin. Of course, we're seeing legalization of some of these substances across the country, and so while there may be some benefits in certain specific settings that are carefully proctored, we are seeing a lot of these substances spill out onto the streets. Um, and so just important to recognize those threats and continue talking about those, regardless of what's happening, otherwise in the country. The Surgeon General's report on the impact of social media on youth mental health was a fairly landmark report that is leading to a lot of funding and spotlight in that area. So while other things are happening in the landscape, as I mentioned, there is a lot of work going on to address that. Of course, everything is sort of TBD right now with the incoming administration and sort of what priorities they will choose to prioritize over the coming months. Of course, there are changes going on at all the federal agencies, particularly HHS. So we'll keep you all updated as we come to know those things as well. To give you an idea of what priorities are for Muslims more broadly, this is data from 2020. You can't see it there, but this was released by ISPU, which is the Institute for Social Policy and Understanding, I believe. So here you see that Muslims care more about healthcare and Medicare than many of the other issues compared to the general public. This is an example of, a great graphic. If you were educating, a legislator on what Muslims care about, if you were in, a specific setting, you may want to do that. But this would be an excellent graphic. It's simple, it's to the point, it conveys, enough detailed information and succinct information that it allows the legislator to walk away with a good point. Muslims more likely than others to hold healthcare as top policy priority. Distinct from the other one, where it was saying that, of all issues, Muslims care most about health. This is saying of the faith groups that were surveyed, Muslims were likelier to care about health than other groups. What can you do? So whether you're a student, early career, professional, here's a few actions you can take. You can sign onto a letter. You can send emails to your legislators. You can pick up the phone and say, hey, just wanted to let you know that it's important for me. It's important for you to vote, in this way, or it's important for you to consider this perspective. You can join a community event. Uh, in the past few years, we've seen a rise in events that are, related to social justice, that are related to community health, that are related to more of that holistic view of health that I was talking about. You can join these things, and, either join the wave of advocacy there. You can join those grassroots efforts, or you can cultivate grassroots efforts there yourself. You can provide testimony to various boards, various committees, commissions. You can go to the legislature. And provide that testimony. You can attend trainings like these, and you can write op-eds and you can join commissions. There's no end to the things that you can do to conduct your advocacy. And if you ever need support on, how to, if you ever need an idea of what you can do to conduct your advocacy, please do reach out to us. We would be happy to work with you and giving you the ideas on connecting you to organizations, connecting you with partners. We're particularly blessed in public health and, as well as in the Muslim community to be partnered up with amazing organizations and to have great synergy and collaborations. So we are always happy to connect folks and to boost that collective impact. A few more notes about different forms of advocacy. You can engage with Congress. You can communicate. You can coordinate with your community. You can organize. You can organize digitally. You can connect coalitions, and you can aid in research and publishing. So if you're a grad student, I know that there's a number of students on this call. You can participate in research and publishing on this front. There are a lot of gaps, whether you're looking at Muslim health or otherwise. There are a lot of gaps in research, and there's a lot of interest in supporting that research, whether it's through funding or other things, to close those gaps up. Some additional tools and resources. Of course, AMP's Health Policy and Advocacy Program. We're always a resource for you. Here's some other organizations that are listed: MPAC, CARE, MGAGE. These are organizations that serve the Muslim interests. Here's a few others: American Muslims for Palestine, Ifanka, that we've talked about, UPNA, AAP, Doctors Without Borders. I'm sorry, the AAP down there for those who it bothers. I apologize. We've got some advocacy guides, including an advocacy guide that's very general. It's got great information. It's got templates on letters that you can use. We also have a khutbah guide. I know that there are some imams on here, some members of the clergy. So there's a khutbah guide on here on strategies and things that you can include within your khutbahs. Whether it's on Friday or post Isha Khatra, there are things that you can include in your talks to kind of boost advocacy as well. Congress.gov, as I mentioned earlier, is a great resource to get most of the updated information on a given bill, legislation. As far as identifying elected representatives, I would use commoncause.org. It's great because it gives you your federal, local, city when possible. It's a great resource. Questions? Let's see. Maybe we can use.
Yes, this is Sharon, and greetings, everyone. Was I supposed to raise my hand, sir?
Oh, that's all right. Hey,
Okay.
welcome.
This is excellent, just wonderful information. My background is respiratory care for 32 years, acute care. So I've seen the various, social determinants of health and how they, actually unfold. And also, I've been an advocate going down to Annapolis. In fact, in 2 weeks, we'll go back to Annapolis and lobby for causes that, of greatest concern. Of course, the children's health, healthy meals, the tobacco issue, technology for those in rural areas. So this is excellent, and happy to be able to attend. Thank you.
Thank you. I appreciate you attending and I appreciate your advocacy. Those are really important fronts to be advocating on. And I appreciate you and I appreciate your perspective. Always important to have diverse perspectives in the Capitol Hill, whether it's state capitol or Capitol Hill. So appreciate you.
Thank you.
Would love to hear what advocacy folks are engaged in. If you're we got a question here. I'm a student interested in getting involved with health equity research opportunities. Is there a list of current projects or people we can contact to get started? Yes, if you wouldn't mind sending us an email at advocacy@amp.us, and I'll have our email actually There you go. So you can send an email to myself at advocacy@amp.us or contact@amp.us, and we'll get you connected with folks who are doing research. There's ISPU and a number of other organizations, including ourselves, conducting research, and we'd be happy to get you connected. And we are happy to share out the slides with the participants afterwards. Thank you. Do you have any tips on advocacy addressing healthcare issues for undocumented citizens due to changes in immigration recently? There is a partner organization that we work with. I can connect you with. They have a plethora of resources. Afroz, if you wouldn't mind sending me an email, I can connect you with that organization or send you those resources directly. Uh, Other than that, no other specific tips other than to, collect as much good data as you can. It is really important when you're doing that to know your audience, right? If you have a particular legislator in mind, if you have a particular body in mind, do your research on who comprises that body. Do your research on that legislator, how they voted. Um, Try to, cultivate data, cultivate stories that would align with that perspective, and ensure that you're packaging appropriately, preparing yourself appropriately. When you reach out, ensure that you are reaching out in a way that is welcoming. I, as a legislator, might not want to meet with someone who is maybe hostile or is coming at it with oh, I didn't like the way that you voted. Always, initiate it as a conversation and say you'd like to speak with them about something. Maybe you'd like to learn how they feel about something, right? Framing it in that way, and they may kind of know where you are at already, but framing it in that way is really helpful in kind of cultivating that environment and cultivating that relationship that will pay dividends for you as you um, engage with policymakers. What research opportunities for advocacy can be available for us. So there are a number of organizations that conduct research on policy, on advocacy. Actually, one of my colleagues, Sheila Jawani, who is on our DMV board, recently presented at APHA on elements of the Muslim policy landscape. So that's just one example. But there are a number of there's really no end to research opportunities. It can be more health related, it can be more policy related. So please do reach out to us, and we're happy to talk about that in more detail, depending on your interests and depending on your skills. It would open up different doors. What is the first step you would suggest to early career professionals to get involved in advocacy if we do not have the qualified credentials? So I would ask you, what does qualified credentials mean? I don't think you need any qualified credentials to conduct advocacy. But I would suggest getting connected to a professional organization. So as an example, when I was completing my master's program, I joined the Illinois Public Health Association. After a short period of time, I ended up running for their executive council, and I was elected to their executive council, which opened up a whole another set of doors. So there's a couple points there. A, definitely get connected to your professional organizations because it's a great professional opportunity, but also just, being a member of AMP, right? We're always happy to connect you to opportunities to conduct advocacy. We have a number of chapter groups that, if you join them, we can kind of route you to different opportunities. Please do reach out to us. But the first step I would, like you're doing right now, attend these trainings, get connected to organizations, look for opportunities to get involved, whether it's promoting surveys or joining research opportunities, joining advocacy days. We are currently fundraising for an advocacy day later this year. So, please, follow us and on whatever platform you're able to, whether it's Instagram, LinkedIn, or email newsletters. We'll be pushing out that information later on this year. And so we'd love to have all of you join our advocacy day. Don't know when it is. just yet, but do stay tuned for that. But there's, advocacy days that you can join. There's community groups that you can join. So I don't know what a great first step for you might be, but there are a number of first steps. But really, as we alluded to earlier, synergy is really great. So find some synergy with a person or an organization. Could be our us, and leverage that synergy. Um, we got another question. Hello, I'm interested in data science and healthcare. How do you think this can be integrated with advocacy? So I'm an epidemiologist by training. I have a master's in public health and a concentration in epidemiology, and then another one in health policy and management. Data science is epidemiology. It is so helpful to have skills related to data analysis. Epidemiologists are a highly sought after sort of skill in public health. Uh, and so it's very much integrated with advocacy. I can't think of a fact sheet that I've seen in recent years that doesn't have data on it or data related to it. There are a number of organizations that are, large. When we think of advocacy, we often think of smaller organizations, right? But there are very large organizations. Could be the American Health Association. They have a large capacity relative to other nonprofits, and they do a lot of work with big data. We did some work with the American Health Association, actually, or I'm sorry, there was American Hospital Association on some big data issues on coding variables and this and that. And so they were instrumental in that conversation. So it can absolutely be integrated. From my experience at state health departments as well, we have a lot of programmers. It's not necessarily the same kind of benefits as Google as an example, but it can be a very, very fulfilling career and can certainly be integrated with healthcare, public health, and other organizations that serve health policy issues. Uh, I see someone sent me a chat message with their email. If you wouldn't mind, I'm going to try to save that, but if you wouldn't mind sending me an email, I would greatly appreciate that. Any other questions? If there's any students on the line, would love to answer any questions that you all have about advocacy. If there's advocates on the call, would love to hear about things that you all are working on that could possibly help inform some of what we're doing and could help possibly help provide some perspective to the students on the line as well.
Yes, this is Sharon again, actually, and I am an advocate, as I said, for American Heart Association. And during the time that we go to Annapolis, is this in Heart Month, of course, February coming up. There are many, many students from various groups that are also part of the lobbying effort, and this is how they learn, how to approach advocacy when they meet the different representatives on the House side and the Senate side. And as you said, that elevator piece, they have to have that together. And it's an excellent experience and whatnot. And you really have to be passionate about, what you're speaking to them about. It has to affect you in some way personally or those that you care about. And so it's an excellent experience. Thank you.
Thank you so much, Sharon. I appreciate you sharing your perspective with advocacy. Um, it is always amazing to see the seasoned advocates at any legislature, the folks who have been doing it, for years and who really enjoy advocating for their communities, for their constituents. And it is always very heartening to see that it's fulfilling for folks and that it's very cup filling. So thank you for sharing that.
You're welcome.
Yeah, inshallah, there will be some future seminars. This was our 101, so we'll inshallah have a 201 as well. We had a great response for this one. So inshallah, looking forward to holding additional seminars in the future as well. All right. Well, if there's nothing else, we'll go ahead and close up. Thank you all so much. I appreciate your time and appreciate your attention. Please do stay connected to American Muslim Health Professionals. Please do complete the quick form to ensure that you are a member of American Muslim Health Professionals on our end as well. Stay tuned to our newsletters. We'll be sending out sign-on opportunities and other information about upcoming events, whether it's related to health policy and advocacy and otherwise. We are also recruiting for our Health Policy and Advocacy Committee. So please do apply to that if you are interested and available to offer some time. That is absolutely one way that you are able to conduct advocacy. We also have an internship that we just opened up. It's posted on our website. So we do have an unpaid internship that we will have for about 6 months. So you can apply to that. There's instructions on our website. So please do consider that. And we look forward to staying in touch and seeing you on future trainings and webinars. Thank you. Take care. Assalamu alaikum.